Connected healthcare is the future of medical services. Doctors, nurses, and staff require 24/7 access and transparent connectivity. Bryn Mawr Medical Specialists Association is a healthcare provider in the greater Philadelphia region. With 10 medical specialties and primary care across 7 locations, Bryn Mawr delivers to patients from basic healthcare to advanced oncology, cardiac care, and internal medicine. And the organization continues to add specialties and offices. We had the opportunity to chat with Andrew Way, Chief Operating Officer, and Peter Otterson, Chief Technology Officer, regarding their transformation leveraging Cisco Meraki and how it transformed their operations. Andrew, let's start with you. Tell us a little bit about Bryn Mawr Medical Specialists Association and how you're positioned in the greater Philadelphia market.
Well, we're a multi-specialty practice. Right now, 10 specialties plus primary care, soon to be 11 specialties. It started with 6 specialties, 6 doctors. Later this summer, we'll be up to like 80 providers. This group was started with the idea of being independent, being physician-owned, physician-run. The physicians are directly invested in the business. We're a team, even though it's, they're the owners, like the business is treated like a team. And I would say in terms of like the new practices, really to some extent, we don't go looking to grow. It's more like if there's opportunity and the right, sort of specialties, right offices, right practices to partner with who want to stay independent and want to become part of a larger, strong and growing independent network. That's kind of where we're positioned right now.
Peter, as the CTO, talk a little bit about the previous infrastructure and what you were facing.
Before we really pretty much had one room, multiple switches, daisy chained, and cable runs out to all the offices in that small main building. Now we were spread across 4 floors to multiple sites. First time ever having to deal with fiber. It would have been a quick learn on the job if it weren't for my Sherpa already having that skill set, both the switches and just the engineering and architecting of the new network for the new building.
So Peter, what was your vision of the new infrastructure?
We just knew we needed something much better on a different scale than we had, much more supportable, expandable, which turned out to be very important as we added more and more doctors and more offices. What we had was adequate, but it would have fallen apart. House of cards, I think, is one of the engineers called it, if we tried to actually scale that up even further. So it really was the technical ability of the Meraki stuff and the technical knowledge and skill of my Sherpa that led us down the path that we went down.
Why did you select Cisco Meraki as your platform of choice?
Again, there was a couple suggestions made by the engineer at my Sherpa. I think Ruckus was one of the ones for wireless. As far as ease of implementation with the cloud-based dashboard solutions that Meraki has, and ease of setup, it really was kind of a no-brainer when we looked at some of the interfaces for the other stuff. And although it worked, and yes, it was all scalable, it was still not anywhere near as easy to implement. And I could do a switch in under an hour.
How has the new Meraki infrastructure and My Sherpa impacted your side of the operations?
Meraki and My Sherpa, what they've done for us is really just streamlined all of our processes and made it, much more efficient to run the practice, to run the IT, when our IT team can sit at their desks and look at the entire network across multiple buildings and see what's going on at our main location and not have to run out and be down a guy here, be down a guy there because they're running to go check things, which they can just see from their PC what's going on. It's significantly more efficient.
Andrew, we started the conversation talking about the growth of Bryn Mawr Medical Specialists. Why would a medical practice join your organization?
And really, I guess, it's being able to now provide that infrastructure where physicians can come and they practice medicine. The infrastructure is there to allow them to do that. And I think it improves the patient care and improves outcomes. Just that they get to focus on their role in the organization, and their job is to take care of the patient. People like myself and Peter, we're responsible for implementing and maintaining the infrastructure that allows all of that to happen around them. And that's, I think, why it works so well and why we've been so successful.
Andrew and Peter, thank you for sharing your experience with My Sherpa and Cisco Meraki. To find out more about My Sherpa and Cisco, click mysherpa.com. And to learn more about Bryn Mawr Medical Specialists, click BMMSA.com. scalable.com.